I have some good news and bad news. Coronavirus cases in Ontario have lowered. On the other hand, bad news is it has to do with the Pfizer health company delaying some stuff. So what's going on is yeah. So so it is day 313 of coronavirus in Ontario since I think in since March 13th. Oof. It is day 25 of the gray zone in southern Ontario, so we're a few days away from not having to deal with the gray zone lockdown rules. Gray zone it still exists. The gray zone lockdown, we're just gonna there's a difference. So there's one problem I really want to focus on, and it is so however so we have coronavirus cases 550 cases from Toronto, so moderately high. So from Toronto, 346 is from Peel region, and 235 is from York region. 46 deaths have been reported. Okay. However, what I want to talk about is so the Pfizer companies that they are like so they had like a vaccine like rollout of like when they produced like a lot of and delivered it to places where can get the coronavirus vaccine and such. And however, they are declining and like slowing it down because so some Canadian provinces have decided to delay giving a second dose, which anyone who is like a health professional that's like very dangerous, like because right now we're in the Pfizer BioNTech vaccine will so long-term care home residents they will get it. Staff and essential caregivers will get the vaccine first. The second vaccine within 27 days, so that's like between 3 and 4 weeks ish. And everyone else will receive the second vaccine rollout. So it will be available. So it will be after 3 weeks, but before 42 days. So it's sort of between 21 and 42 days. So it's really disappointing that the and I can look at right now I'm looking at the information of when that information is going to be get rolled out. So let's see. So this affects Canada. Well, I'm only gonna look on Ontario right now because yeah. So So phase one, they're gonna do with they're focusing on long-term care homes, essential caregivers and staff of congregate care settings for seniors and healthcare workers, adults in First Nations, Metis, and Inuit populations, and adults recipients of chronic home health care. And phase two will involve older adults, beginning with those 80 years of age and older, and then decreasing and then 75, 70, 65, 60, sort of like now. So vaccination will also expand to individuals who are living in and working in high-risk congregate settings, frontline essential workers first responders and education workers, and those in the food processing industry, the individuals with high risk of chronic conditions and their caregivers, and other population communities facing barriers related to the determination of health across Ontario. Okay. Across Ontario who are greater at risk, and phase 3 will see the vaccine availed to every Ontarian who wants to be immunized with the vaccine. So phase 1, yeah. Oh, they're going to send it all out by January 21st. And phase 2, yeah. So they're going to hit the hardest hit regions January 21st, and between that day and February 2015, there's going to be like nursing homes and high risk, the 40% retirement homes. There's that. And the phase 2 is basically March. So like the proof of vaccination. So each individual vaccinated receives a printed receipt of vaccination. If they consent to receive information electronically and provide the need of details, they will receive the digital receipt electronically via email. So there's that. Stay at home. Police are going to be still looking for people who are having large gatherings and issue tickets to those who do. So large gatherings, yeah, are one cause that contributes to coronavirus cases every day. Still, stay-at-home regulations are in effect still. Okay. Coronavirus rules and regulations apply to all, so you can do shopping, work, school, banking, medical and business appointments if arranged and if allowed. Child care services, access to governmental social services, delivery of goods, caregiving. Take a child to their parent or guardian. Take someone in the same household to an appropriate approved place under the order. Helping someone who is experiencing domestic violence, unsafe conditions, or need of emergency assistance. Exercise, walking your dog. Must be leash. I have dealt with so many people not leashing their dogs, and they're in trouble. Skating is allowed in several towns and cities. However, one place, Vaughan, is not allowing that. Check before you go. Attend a place related to the administration of justice, like courts. Section 35 Indigenous Treaty Rights. That's for Aboriginals. Traveling to an airport or or going to a transit station, bus station, or subway, train station for essential travel. Must be essential. If not, you will be named and shamed. Living in a household or of a person living alone, not someone living with others. Buying and obtaining animal food, veterinarian or vet services and assistance, travel for exempt purposes, moving or making arrangements to buy or sell property, or paying again or add the lease. There are fines for those who are who don't want to wear a mask. Yeah, you'll get fined. In businesses and other public spaces and large crowded places outside. Fines and even closures for businesses that are contravening an order. So if you're still running a business that has been told to close because it's not an essential business, if you're not coronavirus screening your staff, no masks on, breaking capacity rules, no safety rules for staff posted, and not checking if staff are following coronavirus rules. Yeah. So individual businesses and franchises have been known for breaking these rules, especially in Hamilton. Fines for gatherings exceeding more than 5 people who are not from the same household. There should be no gatherings for people in Southern Ontario due to gray zone rules until January 23rd. But after that, the no more than 5 people rule still applies. You cannot break it. And of course, fines in effect for the Southern Ontario right now. No social gatherings with anyone outside your household. No social gatherings over 10 inside your household. Limitations, okay. No large gatherings. Whole space 100,000. Every other person who showed up pays 750 each. Possible fine of $100,000 penalty and 1 year in jail. Corporations could pay 110 million. Gray zone last until like Saturday. Saturday is the last day. Schools will be open on January 25th, Monday, for all schools and in Southern Ontario and high schools. And however, Toronto, Hamilton, Peel Region, York Region, and Winter Essex schools will be open on February 10th due to high coronavirus cases. So yeah, look. However, we have a high hospitalizations again with 1,626 people hospitalized, 400 patients in ICU. Oh, great. And 292 patients in ICU using a ventilator. So the cases went down and then they went back up again. For hospitalizations. Long-term care homes, there's been 3,179 deaths in long-term care homes. I just hope that vaccines have made it to these people soon. There are 254 outbreaks right now. So yesterday we had, for the past 2 days, we had 248. So yeah. So I guess the coronavirus plans have been changes for hospitals because they made some professor made some last minute changes. So yeah, there's lots of So follow coronavirus safety rules. Use social media to contact others. Only go on essential travel. Stay out of areas with coronavirus can be high, and follow stay-at-home regulations. You will be fined. And even arrested for breaking some rules. Stay safe, folks, because although even the coronavirus cases may have gone down for the last few days, it could get worse, for better or worse. So don't ruin it. Keep lowering the coronavirus cases right now. Keep following stay-at-home regulations. Have it down below. Stay safe, folks. Maybe we can get rid of coronavirus by the mid-2021.